The traditional Indian postpartum period, the japa or chilla, is culturally designed for rest and healing. But for many modern mothers, the sun goes down and the support vanishes. They are left alone in the dark at 2 a.m., managing a waking newborn while the rest of the household sleeps. Surviving these first 3 months requires a transition in how the household operates. To protect the mother's health, the family must move beyond traditional expectations and manage night care as a structured, clinical shift work protocol. The physical demands are immense. A mother's body burns 500 to 700 extra calories every day just to synthesize breast milk, all while her body attempts to heal from a major medical event. To manage this recovery, the brain requires deep REM sleep. On this 24-hour timeline, we see the absolute clinical baseline. The mother must achieve at least one unbroken 4-hour sleep cycle. Falling short of this triggers a spike in cortisol, which actively inhibits the release of oxytocin. This oxytocin is the hormone responsible for uterine involution, the process where the uterus contracts back to its pre-pregnancy size. Without this 4-hour sleep window, the risk of postpartum hemorrhage increases, making structured sleep a requirement for the mother's physical survival. The husband's corporate job the next morning does not exempt him from night care. Viewing the mother's exhaustion as a test of her devotion ignores the medical reality of her recovery. Whether she is healing from a vaginal birth or major abdominal surgery, she cannot manage these demands alone. For the first 4 weeks, the husband must take over the diaper, burp, and soothe protocol. When the baby wakes, the husband handles the diaper change and brings the infant to the mother. Her only responsibility is to sit up and nurse. Once nursing is concrete, the husband takes the baby back, handling the burping and soothing. As the timeline shows, this saves the mother up to 45 minutes of awake time, protecting her fragile sleep architecture. Between week 4 and week 6, the family prepares for the solo graveyard shift. Wait until the 6-week mark before introducing a bottle. Introducing a bottle early causes nipple confusion and breast engorgement. At week 6, the husband takes the 2 a.m. feed. The mother sleeps in a separate room to achieve the critical, unbroken 4 to 5 hour block of restorative REM sleep shown here on our timeline. Shifting the physical logistics of burping and soothing to the partner is the only way to mathematically secure the mother's mandatory recovery window. The Indian joint family is a massive potential asset, but support must extend beyond daytime advice. To truly protect the mother, the extended family must take over the logistical mechanics of the household. The most significant contribution a grandparent can make is taking the early morning shift. At 5 a.m., when newborns are often wide alert, the grandparents should take the baby out of the parent's bedroom. By handling the early morning walking and diapering, they grant the parents the uninterrupted 2-hour block of sleep seen here on our clock. During these first 40 days, the extended family must manage 100% of household labor. Cooking, laundry, and sterilizing pump parts are the family's responsibility. The extended family's role is to act as logistical operators. By managing the infrastructure of the home, they allow the mother to focus exclusively on healing and feeding the baby. The common advice to sleep when the baby sleeps is only possible in a controlled environment. In an active Indian household, this requires strict boundaries. Husbands and grandparents must act as gatekeepers, enforcing a zero-visitor policy for the first 40 days. As our schedule shows, if the baby sleeps at 11 a.m., the mother must sleep too, and the household must remain quiet and free of guests. While fatigue is expected, there is a line where exhaustion becomes a clinical emergency. Attempting to push through psychiatric distress is dangerous for both mother and child. You must monitor for these clinical red flags. Sleep latency occurs when a mother is finally given the chance to sleep but lies awake with severe anxiety. Other emergencies include overwhelming resentment toward the infant, intrusive thoughts of harm, or visual and auditory hallucinations. A critical physical red flag is a parent accidentally falling asleep while holding the baby on a sofa or chair. This indicates a level of exhaustion that compromises the infant's safety. Do not treat these symptoms as normal fatigue. They require immediate intervention from an obstetrician or a maternal mental health specialist to implement an emergency care plan. A successfully implemented protocol replaces chaos with structure. It ensures the mother is protected during her most vulnerable phase of recovery. Our finalized 24-hour shift clock shows the harmony of these coordinated handoffs: the husband's night assist, the solo graveyard shift, the grandparent takeover at 5 a.m., and the protected daytime nap. Husbands and extended family, this protocol is your direct contribution to the mother's medical recovery. By following these shifts, you are providing the structural support necessary for her healing and the family's long-term health. Share this protocol and establish your family's shift work schedule today. Do not wait for the exhaustion to set in. Build your support system before the baby arrives.